Order, and welcome everybody to this meeting of the Work and Pensions Select Committee, and for an evidence session in our inquiry on disability employment. And we're very grateful to the four witnesses joining us for our first panel, 3 here in person, 1 joining us remotely. Let me ask each of you very briefly to tell us who you are, starting with Kerry Smith.
Morning everyone. Hi, I'm Kerry Smith. I'm Head of Policy and Evidence at the MS Society.
Thank you. Becca Stacey.
Good morning, my name is Becca Stacey. I am a Senior Research Officer at the Money and Mental Health Policy Institute. We work to break the vicious cycle that exists between having a mental health problem and struggling financially.
Thank you. Ruth Wakeman.
Good morning, I'm Ruth Wakeman. I'm Director of Services, Advocacy and Evidence at Crohn's and Colitis UK.
Thank you. And Russell Fleming.
Good morning, I'm Russell Fleming, Head of Communications at the ME Association. We support people with ME, CFS, Long Covid and post-viral fatigue syndrome.
Thank you all very much for being with us. And can I put the first question to you? I'd like to ask each of you to outline the main barriers to work for the people that you are supporting and whether they've changed over the last few years. Starting with Kerry Smith.
Good morning, everyone. So MS, multiple sclerosis, is a progressive neurological condition which affects around 150,000 people across the UK. It tends to affect people, they tend to be diagnosed in their 20s, 30s and 40s. So it's a condition which starts to affect people at the peak of their career and throughout the rest of their working lives. One of the key issues that people with MS face is that in the earlier stages of the condition, it's very often fluctuating. So the majority of people who are diagnosed with MS are diagnosed with what's known as relapsing remitting MS. So they'll experience periods of neurological activity or relapses, which will cause all sorts of symptoms, including fatigue, issues with eyesight and movement, and a really wide range of other symptoms, followed by periods of remission where they may feel better. And that unpredictability can vary on a week-by-week basis, month-by-month, but even day-by-day. And that can cause all sorts of issues for people with MS. As the condition progresses, people tend to experience what we call accumulating disability. So they will have more mobility problems. Many people, as they progress with MS, may need to use walking aids or wheelchairs, and also experience kind of difficulties with things like typing at work or other kind of mobility problems, as well as exacerbation of the symptoms I've already mentioned. So the things that people need to be able to work are a wide range of support measures. So it could be access to flexible working, it could be access to physical reasonable adjustments in the workplace to allow someone to be able to physically access a space. The problem that we encounter, or that people with MS encounter, is that there's still quite a lack of understanding about what reasonable means when it comes to reasonable adjustments amongst employers. There's still a fear that adjustments will require lots of money, and there's a fear of, particularly at the point of employing people with MS, what the response from the employer is going to be when adjustments need to be put in place. So what we find is that a lot of people, we're seeing around half of people with MS are in employment, and a lot of people with MS would prefer to stay in employment for longer, but the main barrier to them is not having the right adjustments put in place by their employer. That support to be able to stay in work for as long as possible seems to be the main issue that we're encountering.
Have things changed much in the last few, or is it?
So, unfortunately, we haven't seen any marked change.
Okay. Becca Stacey.
Thank you. So yes, unfortunately, despite advances having been made in addressing stigma relating to mental health problems, the mental health employment gap still stands at 28 percentage points as of 2023. So that's 51% of people with a current mental health problem being in work, compared to 79% of people without a current mental health problem. And there's a number of different reasons that are driving barriers to work for people with mental health conditions. So some people, because of the nature and the severity of their condition, are not in a position where work is going to be appropriate. But there are many people with a mental health condition who would like to work and who face barriers such as a lack of effective support to access work that's personalised and bespoke and understands the barriers that they face as a result of their condition. Biased recruitment practices is all too often something we unfortunately hear about, in particular people having difficulties explaining gaps in their CV, for example, which might be as a result of periods out of work due to poor mental health. When it comes to then being in the workplace, discrimination still is an issue that we still hear about from members of our research community, which is a network of 5,000 people with lived experience of having a mental health problem. We know that 1 in 5 people with a mental health problem have experienced discrimination in the workplace. And there's also a lack of action from employers to make workplaces accessible and supportive to people with mental health conditions. So going to Kerry's point about reasonable adjustments, we know that of people with mental health problems who've requested a reasonable adjustment, 2/3 of those either haven't been met or have only partially been met. So there's still a big way to go in terms of employers making the adaptations that are needed to make work accessible. And the final point to make is that half of us in our life are going to experience a mental health problem. So the failure to address these challenges that we people with mental health problems face to work is essentially a failure to address the challenges that tens of millions of us are going to be facing in the future going forwards, which will continue to impact on low employment rates, will continue to impact on low tax revenues, but most importantly will continue to have an effect on the financial and mental health of individuals themselves.
Thank you. Ruth Wakeman.
So Crohn's and colitis affects around 500,000 people in the UK, so that's around 1 in 123. And the reason this inquiry is particularly of interest is that many people are diagnosed before their 30s, so you're looking at people throughout their working lives. And Crohn's and colitis is a relapsing, remitting condition. It has a serious impact on people's lives. So symptoms include frequent and urgent diarrhea with blood sometimes, which we're talking about 20 times a day, pain, fatigue, and also many people will require surgery at some point in their lives, sometimes repeated surgery. And we're talking about major surgery with part of the bowel being removed and people needing a stoma, either temporarily or permanently. So you can see that the conditions have a really serious impact on people's lives. And 68% of people with Crohn's and colitis have told us that it has affected their career and their working life. And the system doesn't work for relapsing, remitting, invisible conditions. And there is a complete lack of understanding and awareness. So somebody may look young and healthy, but that doesn't mean that they aren't severely affected. And so making sure that people have the practical adjustments that they need, and that might be priority for flexible working requests, access to toilets, sitting near toilets, and recognising that people may be well for periods, but then they may also be seriously ill. So there needs to be much more support for employers to enable them to keep people with long-term conditions in work throughout their working life, and also much more education and awareness raising as well for employers. So it's really thinking about, we hear stories of people, for example, simple things, they need to sit near the disabled toilet in their office, and perhaps the disabled toilet is always used by somebody getting changed because they're cycling or running, and the employer is not supporting people, recognising that they have a serious condition and they may need to access that toilet urgently throughout the day. So I think the current system is very focused around equipment and more visible disabilities, whereas we do need to think about serious long-term conditions. And just to add, I think the language needs to be more inclusive as well, because many people with Crohn's and colitis won't identify as disabled, even though many of them will meet the legal definition for having a disability. So it's also thinking about long-term serious conditions and how can we think about supporting people with those conditions to stay in work.
Thank you. Russell Fleming.
Good morning. Can I start by saying that I think it's essential that what we need first is good healthcare to be put in place for people with ME, CFS and Long Covid, because I think that's the best chance of improving life quality in the absence of any effective treatment, because we don't have any effective treatment at the moment, and before any further welfare reforms are considered. There's been two key developments in the last couple of years. The first one was that the National Institute for Health and Care Excellence produced a new NICE guideline on ME/CFS that was welcomed by clinicians working in the field and by patients. The challenge ahead of us now is to ensure the guidelines recommendations are implemented effectively across the UK, because we need specialist services in place so that newly diagnosed and patients who have had the illness for a while can be referred to good specialist services who can help them learn how to effectively live with the condition and manage it. And also, when a person feels able to return to work, they can also be there to provide that liaison between healthcare and employers, which is another key recommendation in the NICE guideline. There's also been a second key development. We've been working with the Department of Health and Social Care since May 22 on a delivery plan, and this will prioritise implementation of the guidelines recommendations and improve training on ME/CFS for medical professionals. It will also examine, and the DWP has been part of this development, the employment opportunities, which we as a charity would like to be involved with, and we are considering an employment campaign next year to raise awareness with employers and trade unions of ME/CFS and Long Covid, of long-term conditions, and about how they can work better with potential employees. There is limited research available, unfortunately, in our field, but based on the latest evidence on ME/CFS and data from the Office for National Statistics on Long Covid, we might estimate that there are around 770,000 people with ME/CFS and Long Covid in the UK today. And these people's ability to initiate or complete normal everyday activities is extremely limited a lot, or limited to some extent. It needs to be recognised that ME/CFS and Long Covid can greatly affect a person's ability to complete normal everyday activities, and that these medical conditions affect a person's cognitive and physical function. For example, their ability to communicate, to think clearly, to process and retain information, to access energy on demand, and to mobilise normally. People can also be extremely sensitive to external stimuli such as light and noise, and they need to rest more often than normal. The impact of the conditions on a person's mental health should also not be underestimated. So these kind of things need to be taken into account on an individual basis whenever anybody feels able to return to work. They're chronic and fluctuating medical conditions, and I don't think fluctuating conditions are discussed enough or truly appreciated. And I would echo what was said about multiple sclerosis in this respect. People who do return, people are very motivated to return to work. I haven't come across a single person who isn't. And often people will try to return to work before they're actually able to return to work. So they will have this sort of stop-start. So what we need, when people are physically able to return to work, we need to find them jobs that they can actually achieve, that they can stay in and you know, are sustainable. At the moment, there just doesn't seem to be those kind of opportunities. I know we'll come on to talk about work capability assessment, etc., and perhaps we'll talk again about remote working opportunities.
Okay.
That's as much. Yeah.
Thank you very much. Can I just follow up a quick point to you, Becca? We'll keep it quick because we're a bit under the cosh on time this morning. As you know, the Prime Minister and the Secretary of State have both warned recently about the dangers of medicalising the everyday challenges and worries of life. What's your response to those concerns?
We've been really concerned about those claims, mainly because they're very misguided. We have seen a very real and genuine rise in the number of people who are dealing with very genuine mental health problems, in some instances very severe and debilitating mental health problems. This isn't people medicalising everyday stresses and worries. These are people dealing with, quite intense mental health problems. And I think for us at Money and Mental Health, we're not entirely surprised about that rise in mental health problems because there's been an increase in known financial drivers of poor mental health. So we've come off the back of a pandemic where people's finances have been stretched. We've then gone into a cost of living crisis where we know that over half of UK adults have felt either stressed, unable to cope, or anxious as a result in the rise of the cost of living. For some people, that effect has been a lot more severe. So 1 in 6 people have had suicidal thoughts or feelings as a result of the cost of living crisis. Combine that with the fact that we still have inadequately low levels of social security support. For us, the real question is around how do you address those financial drivers of poor mental health instead of essentially scapegoating the people who are being impacted by it. And the final point to make is that alongside those financial drivers, we've also seen an increasingly difficult ability for people to access mental health support. So there are 8 million people as of 2021 who have a mental health condition who are not in touch with the services that they need. There are long wait times, there are difficulties getting the right level of support that people need, and all of these are the true issues that the government should be looking to address, not the people who are suffering as a result of the lack of action on those factors.
Thank you. Senator Swain.
The government policy is informed by the disability employment statistics. Those rely on self-assessment by those people who have the disabilities. Is that a problem? Does it matter? And if it does, how could it be changed without disproportionate cost and bureaucracy? In any order.
Yep. Shall I start? So yes, it is a problem because, as I mentioned in my introductory words, many people with long-term serious conditions such as Crohn's and colitis won't identify themselves as disabled, so they're completely missing from those statistics. So I think we need to think about how we're capturing accurate statistics on people who are unable to work or are unable to work fully in a full-time role, and it's thinking about different ways of addressing that issue. So thinking more flexibly around things like partial sick leave or supporting people to stay in work, having priority for flexible working requests, and thinking about those adjustments that people may need with long-term conditions. So it does seem to be as though it's more of an all or nothing approach, but we need to think about how we support people throughout their working lives to stay in employment, and those needs, particularly for someone with Crohn's and colitis, will change throughout their lifetime. So how can we flexibly support and empower employers to keep people in work for longer?
I think from us at Money Mental Health, it's about creating workplaces which are supportive and encourage people to feel able to share their mental health condition and to disclose. We know that among our research community, only 29% of people will disclose to a prospective employer about their mental health condition, mainly for the fear of the discrimination they could face on the back of that, or different treatment at work, or being passed up opportunities for progression or promotion, for example. We would be reluctant to see a focus on diagnosis-based recognition of mental health problems. There are plenty of people who do have a diagnosis and know exactly what reasonable adjustments and flexible working they might need on the back of that. But there are also people who do not have a diagnosis but who do still face very real challenges with their mental health that affect them in the workplace. So it's about equipping line managers and teams more generally with the training to be able to create a workplace where conversations about mental health are encouraged, people feel able to share that, and are knowledgeable that when they do make that disclosure, support, adjustments and flexible working can be put in place on the back of it.
So MS is in an interesting position that under the Equality Act, anyone with an MS diagnosis is automatically considered disabled. But one of the issues that people experience is very similar to what Becca's just described about people with mental health conditions. There's a real concern amongst a lot of people, particularly where their symptoms of MS are less visible, about what will happen if they are to disclose that they have MS, what the perception will be of them as an employee. And there's definitely a lack of awareness about MS as a condition. I think it was Russell that mentioned kind of similar issues around ME/CFS as a condition as well. There's definitely an issue there about how well equipped employers are to have those conversations where they've identified potential issues, but where the person may be reticent to talk about their diagnosis or what they're experiencing. So for us, it's a twofold issue. There is an issue around how comfortable people feel to disclose themselves as disabled in official statistical releases, but it's actually much more about what's the on-the-ground experience for people with their employers, and their employers proactively identifying where support could be put in place.
Russell, do you have anything to add?
Yeah, I would just like to stress again, it's highlighted in the NICE guideline that ME/CFS or ME or chronic fatigue syndrome in particular has suffered a lot from stigma in the past. I was diagnosed 24 years ago with the yuppie flu banner still flying around social media. Well, not me, social media at the time, but the media at the time. I think since the NICE guideline was published, we could sort of mark a line in the sand, but it is still awkward describing this illness. It is still difficult coming forward to say you've got this illness. We're still faced with GPs, unfortunately, and, social care professionals who don't get it, who don't believe in it, who don't validate a person's experiences, who don't give the correct diagnosis. Like I say, I'm desperately hoping that since the NICE guideline was published and the Department of Health are bringing about this delivery plan, we can see some fundamental changes. But yes, I would certainly imagine there are a lot of people that have the symptoms but not a diagnosis, who don't get picked up by any official statistics, who don't get the benefits that perhaps they should be entitled to. So around stigma, I think ME is a very good example, unfortunately.
Thank you very much indeed. Celine Saxby.
Thank you and good morning. Some of the barriers, such as local transport networks and access to NHS treatment, will vary across the country. For example, I represent a very rural community or more deprived areas. Do you think we pay enough attention to this point?
We did a piece of research a couple of years ago actually looking at how experiences of money and mental health vary across the UK, and time again what came up was poor access to regular and affordable public transport, which is so interlinked with people's ability to access local labour markets. So again, among our research community, we found that only 42% of people agreed that they had access to regular and affordable transport, with huge variations between urban and rural areas. So it's something which absolutely needs to be taken into consideration, especially given the fact that people with mental health problems are more likely to be on lower incomes, so therefore will face further barriers to accessing that transport when it is prohibitively expensive for people.
Thank you. And I'm aware that there are some issues with bus pass times, and so that even if you have got access to transport, that the blue badge is only available after 9:30. Is this something that you've also come across as an issue? Or?
Sorry. It's not something that necessarily comes up a huge amount, but obviously it does add on an extra layer of complexity and what a lot of people with MS describe as kind of disability bureaucracy. So kind of having to be very keenly aware of how you can utilise things like a disability rail card or bus passes, for example, to be able to travel.
Thank you. Is there anything you'd like to add, Ruth? Russell?
Just to say, for people with Crohn's and colitis, accessing those passes and blue badges in the first place is incredibly challenging. And to get a blue badge, many people with Crohn's and colitis are turned down. There's no recognition of the fact that many people will have incontinence or urgency and will need to be able to park quickly so that they can access a toilet straight away. So the system doesn't work for those type of conditions. And thinking about the rural versus urban and the sort of different variations, I think it's around transport links, it's around huge variation in waiting lists, and also access to specialist care as well. So you may be living in an area where there is no specialist Crohn's and colitis care, and waiting for tests and investigations such as colonoscopy vary hugely across the country. We hear from people waiting over a year for a colonoscopy and then waiting another year to see a gastroenterologist before they can start treatment. And that is very different in different parts of the country. So while people are not on treatment, their condition has worse outcomes, but also they're not able to return to work.
Thank you.
Sorry, can I just add one on the health side of things? That's definitely something that we see in neurology. There's huge variations in the number of neurologists available per capita in different parts of the country, and there are entire areas, particularly rural areas, where there's not even a single neurologist to be able to support people living in their area. And the other thing that we've seen since the pandemic is a huge shift in the availability of NHS provided physio, which is a huge support mechanism for people with MS in particular to remain mobile and be able to work.
Thank you. And Russell, I can see you nodding along. Is there anything you'd like to add?
Yeah, I would echo the fact that, applying for a disabled bus pass for a disabled bus pass or for disability blue badge is just another thing that a disabled and sick person has to try and go through. And the local authorities just don't make it easy now. In terms of healthcare, there are some good examples. I live in Cornwall, for example, and we have an ME/CFS specialist service and a long COVID clinic. And while they're attached to the Truro Hospital here, they offer local clinics around the county because it is a very big rural county, as perhaps you're aware, which makes accessing the clinics easier. They also offer remote access, so for patients who can't leave their homes or their beds, their carers or themselves can sort of get in touch with clinicians and attend various appointments. But there are also, this is a postcode lottery, of course. We don't have the same standard of provision everywhere, particularly Wales, Northern Ireland and Scotland, you don't get anything. And this is another thing we're hoping from the NICE guideline, that there will be some sort of standardisation of available care and support for people throughout the country.
Thank you. And there is a current campaign to allow blue badge holders to use e-scooters and other such electrical vehicles on the road. Do you support this campaign?
I just don't think the people that we represent would be capable of using those things. So, I don't think it'd be relevant.
Any other?
Well, I think I can't comment on that exact campaign, but I think we would support anything that is going to enable people with invisible disabilities to get out and about and recognise what their particular unique needs are. So that will be very variable depending on the type of condition.
Thank you. Anything you'd like to add, Becca?
Not from us.
So the government has also said that the rise of remote working will make it easier for some disabled people to work. Do you think this is right? And are there enough of these type of jobs to actually make a difference to the disability employment rate?
From our perspective, there can be many benefits with remote working. It can be a great way to enable someone to manage their mental health condition alongside work. I think where there's been a lack of understanding is around the availability of work from home roles. So people with mental health problems are overrepresented in low-paid work. I think it was as of the second quarter in 2023, only 8% of people in low-paid roles were primarily working from home. So this expectation that there are these sorts of jobs available is pretty detached from the reality. And the other point to make is that while some of us might be able to better manage our mental health if working from home, there are many instances where the challenges that we face in a workplace do still persist. So there's still the expectation that you engage socially via calls, video calls, emails. That can still present challenges with social anxiety, emotional self-regulation, following conversations, and other symptoms related to having a mental health condition, say, for example, low levels of energy, motivation, difficulties keeping up with tasks and deadlines and time management. All of those still exist whether you're in an office or you're working from home. And again, I think there's a lack of understanding about how a mental health problem can affect you and the fact that the environment doesn't necessarily alleviate those challenges for everyone.
Thank you. Anything anyone else would like to add?
Yes, so for people with MS, I think for certain groups of people with MS, it's been a benefit to have kind of more normalisation of working from home. So it allows them to manage symptoms like fatigue, and any kind of continence symptoms they might have if they can work from home and not have to manage a commute, for example. But I just want to echo what Becca says, which is that has to be supported by an inclusive working arrangement. So there may be barriers that people are still encountering just by the nature of the work that they're doing. And perhaps other adjustments that need to be put in place to support people with MS to continue working effectively. And there is also, I think, I would say there's a lack of data definitely about the how different groups of people are accessing or being able to work from home effectively. And I think there's been perhaps an overgeneralisation that this has become something that's available to the whole workforce, when actually we do encounter quite a few people with MS who were perhaps working in retail roles and have to leave the workplace much, much sooner because the ability to work from home just simply isn't available.
Thank you.
Yes, I mean, I would just add that remote working does have benefits for some people with Crohn's and colitis, and we heard from people during the pandemic that, you know, suddenly they were able to manage their symptoms and their fatigue, and the problems of toilet access were less, and reduced commuting. But many people with Crohn's and colitis are working as teachers, nurses, supermarkets, transport. So we just need to recognise that remote working isn't the answer for everyone. And also I think it's really important that people aren't forced into working from home. The answer is actually to have supportive employers, inclusive workplaces, so that people have the same opportunities to work in careers and progress as people who don't have long-term serious conditions.
Thank you. Is there anything you'd like to add, Russell?
Well, I would just add that I would not be working today if I hadn't been offered the opportunity to work remotely from home. And, you know, I never expected to end my career working with a charity. I was working in private banking. That was my career. I was investment manager before I got ME. But, you know, I started, the charity offered me a role. I started volunteering, just doing a few hours a week, slowly built it up. My symptoms allowed. I went part-time and you know, then I went full-time about 4 or 5 years ago. I couldn't do that without being able to work from home. I have a lot of support around me to enable me to work from home. It's not easy, you know, I need to work flexibly. I will start work in the early hours of the morning if I've had a particularly bad night or I've had a seizure or something and I've come round, and sometimes just being able to get into work actually helps me to clear my mind. But it isn't for everybody. You know, we need to consider everybody's abilities. It is a useful stepping stone though, perhaps. You know, I'm just not convinced that all employers have accepted remote working. I think the government thinks there's a lot of opportunity out there, and we just can't find any evidence to support that, which was why we responded as we did to the work capability assessment consultation. Yeah, so it's great to think that we can use technology in this way, and it can enable disabled people who are able to work. But I don't think it's going to be for everybody, and I don't think it's going to be for every employer.
Thank you. Thank you, Jeff.
Thank you very much indeed. Russell, can I just ask, so you've worked full-time at home for some time. Were you doing that before the pandemic, or was it the sort of pandemic changes that made that possible?
Yeah, we were doing it before the pandemic. I mean, the ME Association as a charity, we employ disabled people with ME, Long Covid, as well as healthy people. And we've always offered this, you know, remote working opportunity. And it helps, you know. My team have all got ME, and we all work flexible working arrangements around each other, and we make it work. And we're better for it.
Thank you. David Linden.
Thank you very much, Chair. So let's say we're in a situation where good work has been done to try and get more people with a disability into the workplace. I want to maybe turn some of the questioning now to what we do in terms of retention, to make sure that we're supporting disabled people in work. Now, Ms Wickman, you gave a very good example earlier on about, you know, in a workplace, if there's somebody with Crohn's and colitis who is working at a desk, they would need to be positioned closer to a disabled toilet. That disabled toilet might be used also as a facility for folk to change out of their Lycra or whatever if they cycle to work. Can I ask some of the other panel to give us a few more examples of areas where employers could make reasonable adjustments that are perhaps not happening at the moment? And if we start with Ms Smith and work our way along, would that be all right?
So I think I already mentioned, but there's broadly speaking sort of a twofold response. So one is where people need physical adjustments in the workplace, so making sure that people have access to height adjustable desk, for example, if they are using a wheelchair, or speech to text software if they're unable to type anymore, because dexterity can be affected as a result of progressive MS. People with MS, as I've mentioned, do often also experience continence issues, so being close to a toilet, having access to a properly allocated, accessible toilet is really important. But there's also a real need for that understanding about flexible work arrangements as an adjustment as well. So the ability for people to use perhaps compressed hours or having a really good flexible working policy in place to allow people to manage their work time more effectively, just particularly works obviously for people in office-based jobs, but it's something that at the MS Society, for example, we have quite a very flexible working policy that can allow people to manage their symptoms. So if they do wake up one day dealing with particular fatigue issues, that they can then manage that and perhaps kind of work a slightly longer day on a day where they're feeling slightly better. The issue comes back to there's not enough flexibility with enough employers, which is something that people really struggle with. There's also obviously
Is that just a culture issue? Or?
And also it depends on the workplace and the type of work and the expectations around it. If you're working somewhere that has an expectation around shift work, you can't necessarily work flexibly in the way that someone who's working in perhaps an office-based job may be able to. The other thing as well goes back to the point around stigma and people's fears around disclosing their impairments. I think particularly for people who are more newly diagnosed with MS, who may be younger, there's a worry around coming to terms with their diagnosis and the effects of treatment. That's something that I haven't yet mentioned. Obviously people with MS, particularly with relapsing remitting MS, will be mainly on what we call disease-modifying therapies, and some of those can have quite large side effects. So particularly if people are on infusions, either on a kind of four-weekly basis or a 6-monthly basis, around the time that they're having their treatment, that can kind of require them to take time off, and people don't necessarily understand that they may be able to take disability leave or sickness absence without that kind of affecting their employment record. We do hear of people using things like annual leave to be able to kind of manage those periods of time, which we don't think is particularly fair or appropriate. So it goes back to that point that I think there's a lot more understanding around physical access and accessibility, and going through an occupational health assessment, for example, to put in place physical things like an ergonomic desk arrangement. Less understanding though around kind of flexible working arrangements and how people can manage a fluctuating and progressive condition.
Okay. Stacey, do you want to add to that?
Yeah, so for people with mental health problems, reasonable adjustments can range from, say, for example, as Kerry was mentioning, flexing hours, so enabling people to take more regular breaks, for example, or allowing people to take time off if they need to attend mental health appointments. The workplace in itself, as well as the work from home adjustment, also the ability to create quieter spaces within an office so that there are less sensory demands on people who might struggle in noisier and busier parts of an office. And then also when people are going through periods of poor mental health, the ability to adjust workload, for example, reducing some of the tasks that people are expected to do or some of the more high-stress tasks, so say, for example, customer or client-facing roles. And I think the point to make with reasonable adjustments is a lot of the time when we speak to people aren't aware of what adjustments could be made, or that in itself is a barrier to them making that request because they're just not sure what their employer could put in place. So what we would love to see is employers essentially being proactive in identifying what sorts of adjustments they could make, communicating those both throughout the recruitment process and also to existing staff, so that people feel empowered and able to put in those requests and know what could be available to them.
Okay. I know I've cited Crohn's and colitis case. I'll go back to Mr. Fleming before I come to you, Ms. Wakeman, if that's all right.
I would echo completely what's already been said. I do think it's difficult as a person with this condition. It is difficult knowing what you can expect an employer to do without that employer feeling you're not going to make a very good employee. If there's a feeling, isn't there, that you don't want to be too demanding of a new employer, because then it diminishes the attractiveness of you as an employee. So I do think there needs to be more understanding and awareness around the kind of reasonable adjustments that could be put into place. And again, to echo, there's a lot already being done on physical disabilities that are recognisable. Somebody in a wheelchair, for example, but so-called hidden disabilities or invisible disabilities, I think there needs to be a lot more work done Adjustments such as flexi hours, being able to take breaks when you need them to go and rest. We've talked about remote working opportunities. There's also a bit of a disconnect, I think, between the size of the employer. When we have discussions around this topic, we seem to be talking about quite large employers, usually office-based work. I don't think it translates across to other forms of employment necessarily well. So I think, again, that needs looking at.
Okay, and I want to come on to, because we touched on people self-disclosing to their line manager. I'm actually in a situation where a member of my staff in the last couple of years got a diagnosis of ADHD. And so that was disclosed to me as line manager. We made sure that we got things like noise cancelling headphones to support that individual in the workplace. But what more can be done to address that challenge when you've got to self-disclose to your line manager? What can we do to kind of try and encourage a bit more of that? Does anyone get anything they want to add?
One of the things that we encounter is where there's openness right from the off when someone is looking to work for an employer. So one of the concerns that people raise quite frequently about, if they're living with MS and looking for a new job, or have been diagnosed with MS when they're working somewhere, is that openness and upfrontness about the culture, I suppose, of acceptance of disability in the workplace. So workplaces have quite clear policies around support for disabled colleagues, or there's a disability network, for example, that can kind of provide that peer support and advice and guidance. That makes a big difference. Where you have things kind of written down in policies, that will obviously make a big difference in terms of the level of trust. That being said, people, even with that, will, particularly if it's a new diagnosis, will be struggling sometimes to come to terms with a new diagnosis, and a lot of that then comes down to the empathy and support from the line manager to try and unpick where there may be problems identified. Employers do have a duty where we could reasonably deduce that someone is disabled to try and provide that support, and part of that does need to involve having those conversations where someone is clearly struggling, or perhaps could do with a bit more support to try and get them to open up and build that trust for them to talk through what support they require without necessarily having to disclose what the exact diagnosis is. So taking much more of a social model approach to supporting people in work rather than a diagnosis approach.
Anybody else have anything they want to add before I come on to the next question?
Yes, I was just going to add for Crohn's and colitis, it's 1 in 123, so everyone will know someone with Crohn's and colitis, but you may not know that you know someone with Crohn's and colitis because people don't talk about it. Poo is the last taboo. It's quite a big step for somebody to talk to their employer about a bowel condition and explain that they may have incontinence, that they need to run to the toilet frequently throughout the day. So it's a big step for someone to disclose that, and so many people won't disclose or don't want to disclose. But even when they do disclose, the level of understanding and awareness from the general public, and so employers as well, is that people don't realise these are serious conditions, and they think, it's a bit of a tummy ache or a little bit of diarrhoea. So people have a real battle to get across what they actually do need in the workplace. So I think much more general awareness raising around serious conditions. Scotland did a great awareness raising campaign for Crohn's and colitis, and it would be great to see something like that across the rest of the UK as well. So much more awareness, education and support for employers, so that even when someone does disclose, they know how to react and what to do and what those conditions may mean.
Okay, and then just the last question I'm going to ask each of you is, firstly, what can government do more to encourage employers to employ more disabled people? And then this issue around about the introduction of mandatory disability workforce reporting for large employers. Am I right in thinking it's maybe about anything from 250 upwards or something like that? Is that right? For the if you've got 250 employees, do you support the mandatory workforce reporting? So if we start with Mr. Fleming and then work our way back.
Sorry, I don't know anything about the mandatory reporting.
That's fine.
What was the first question?
The question was what more can be done to encourage employers to employ people with a disability?
I think we need to look at the skills available to potential employers. people do have lives devastated by ME and long COVID. They're often dragged out of, hard-fought careers. They can be quite highly skilled. I mean, it can affect anyone. But, raising awareness to employers of the potential benefits of employing, highly motivated people with disabilities, particularly with ME and long COVID, who possess, strong skills. We found as an employer, I mean, employing people with these conditions has brought huge benefit to the charity. I know we're a charity, but their expertise and skills applied in a different way have been amazing. Some people do return to jobs related to their former careers in a different capacity. I think education and teaching tends to be a big sort of catchment area. I think a lot could be done to raise awareness. We hear from former teachers trying to return to roles only to find that schools are not accommodating, they're not flexible enough. So I think there needs to be more understanding on both sides, trying to find accommodations. Job sharing is a good option, as well as other possibilities. Just as has been said about Crohn's, just more general raising of awareness, meeting with employers, learning more from employers what their problems are. Maybe we can help employers as well.
Okay. Yeah. Thank you. Ms. Wakeman, do you want to add anything?
I think with mandatory reporting, the devil is in the detail, because what difference is it actually going to make? How will disability be defined? And then how will employers are responding to the mandatory reporting be measured? So I think there's a lot more to think about and understand around mandatory reporting. And as I've mentioned, thinking about long-term serious conditions wider than disability. So it's about changing the conversation, I think. In terms of what the government can do, I think the system doesn't work for people with these long-term lapsing, remitting conditions. I think the language needs to be far more inclusive, and I think there needs to be a lot more support for employers, so education and awareness raising for employers. It's good for everyone if people with long-term serious conditions can be able to work. So supporting employers to keep people in work, and that includes people who may need periods of time in hospital. They may need time off medical appointments. They may have periods of time when they're very unwell, but supporting employers to keep those people on so that when they are well, they are able to work. So really being much more flexible about different ways of supporting people with long-term conditions.
Yeah, so from Money and Mental Health's perspective, in terms of what the government can do to support more employers to employ people with mental health conditions, there's a couple of things that we haven't touched on before. So access to work is a fantastic scheme, but as we know, the backlog for people getting a decision on their access to work claim is huge. I think as of December 2023, it was around 25,000 people waiting.
37.
It's 36 now.
36, okay, yeah. Thank you, yeah. So
I don't want to steal too much of Mr. Mill's thunder, because I think he's going to come on to this shortly.
So putting resource and personnel into addressing that backlog is key. The other really key thing that we want to see is a shift from a right to request flexible working to a right to flexible working. Because quite often what we see is individuals themselves not feeling like their flexible working requests will be honoured, or whether that could result in them being treated less favourably or passed up for opportunities within the workplace. So people face barriers to making those requests, and if there was a shift whereby it was a right that employees had, you could see a hopefully more empowering ability for people to feel like that is something they are able to do and should be putting forward. And something we'd also want to see to encourage employers to actually start acting on those reasonable adjustment requests more is reporting for larger employers, so people with over 250 employees, to start publishing the amount of reasonable adjustment requests that they receive and their responses to those, to try and create a bit of incentive for employers to make those adjustments that can make work more accessible. And on the disability reporting point, I think we'd echo what's been previously said. I think there's a degree of other measures that should be looked into. The mental health income gap is a really significant issue. There's other measures which would be also useful to report on. And the main point is the purpose of this. So if there's no repercussions for employers who aren't actually taking the steps to employ more people with mental health conditions and other disabilities and health conditions, there's very little effect from the likes of having this mandatory reporting in place.
I just wanted to point out as well a drawback with mandatory reporting that is given the issues that we've talked about in terms of people feeling reluctant to disclose their impairment or condition at work, if they're working for an employer where they feel that a disclosure could be used against them in some way, then what you may end up with is actually an under-reporting of disability data. So I think I'd echo very much what's been said about kind of, we would be much more keen to see a strengthening around and transparency of reasonable adjustment requests and how many of those are granted. And in terms of what the government can do, so one of the things that people with MS bring to the MS Society quite regularly is a concern around business reasons being given for turning down a reasonable adjustment request, but no detail provided.
Cost too much for a height adjustable desk.
Exactly. So it might just be as simple as cost. But without really much more detail. So we would like to see a strengthening of the Equality Act duty around detailed response, timely response as well to someone who's made a reasonable adjustment request. Ideally, it should be done within a couple of weeks to say, okay, well, this will cost too much, or we think that we'll need to go down an access to work route to be able to justify the expense of doing this. At the moment, it's just very inconsistent what requests will be granted and in what way.
Thank you all so much for your evidence. I appreciate that, Chair.
Thank you very much. We are going to need to speed up a bit, I think, given we're getting a little bit behind. But Nigel Mills.
Ruth, can I just follow up on one thing there? When you say there should be more support for employers where they've got an employee that's off for a long period with sickness, what do you think that support should be?
I think it's about more flexibility with the sickness pay and supporting employers so that, a good supportive employer who is able to do this will recognise that someone may be off for a few weeks, even a few months, but then they will be back in the workplace able to do their job, maybe for years, maybe for the rest of their working life. But at the moment, the systems are not there to support employers to keep somebody in work. And thinking about smaller employers particularly as well, currently the system just doesn't work to provide that level of support.
And are you kind of suggesting that the employer should be able to reclaim sick pay or something? Is that
like furloughing and during the pandemic kind of arrangement? The other thing, if you've got one of these conditions we're talking about and you do incur a relapse, you could be on statutory sick pay, reduced pay. The employer's also unable. They've got a gap in their staff. So that I think there should be more help on both sides, to be honest. I think it's, when you've got a long-term condition, it should be expected almost that there are going to be periods when you are just not capable of turning up for work. And for an employer's perspective, yes, we had furloughing, didn't we? And employers could claim the compensation for staff that were off. Yeah.
And then, thank you. And Becca, can I just ask about the right to be entitled to flexible working? How could we draft that? Because presumably if I'm a bus driver and I request to work from home, that's not going to work all that well, is it? How do you craft a requirement that could reasonably be enforced on employers when you've probably got quite a lot of jobs where you just can't have that flexibility?
I think that's why it's really important to go back to the point that employers themselves are really proactive about what adjustments could be put in place given the context of the working environment that they are situated within. Because only 1 in 6 people with a mental health condition have put forward a reasonable adjustment request, the real barrier is around fear of that not being granted. And I think given, yes, there will be some workplaces where different adjustments are going to be more acceptable. So the more employers can communicate what they could do and the more that they encourage people to put forward those requests, therefore addressing some of the stigma and the concerns about subsequent discrimination that individuals themselves face, the better. And I think the more that you sort of encourage employers to then report on that, there's again creating that environment that shows to people that these adjustments, some of them can be very small and can still have a very big impact on the accessibility of a workplace, on the back of them, can be put in place.
So it almost becomes a right not to refuse unreasonably or something, or with that sort of language you have. Okay, can we switch back to access to work there, which I think in general our feedback is it's a brilliant scheme, but no one knows about it, and it's a bit slow, and it's a bit of a nightmare if you change jobs and you have to go through it again. I mean, is that your experience? Have you sensed anything improving in recent periods?
So from an MS Society perspective, I don't think we've seen much improvement in it. Where it works, it is brilliant, and it does have a transformative effect on many people's ability to be able to work. Obviously, it does allow for more expensive adjustments to be made, or for things like taxis to and from work to be paid for, which obviously allows for the disabled person to be able to afford to travel to and from work where they may not be able to otherwise. That being said, if you move jobs, I'm pretty sure even if you move house, it's very difficult to port it over. And there's obviously an issue where if someone is wanting to move to a new employer, they can't even give an indicative award to that employer. They have to be offered the job and have taken up the employment before they can then reapply for access to work. So we definitely support the idea of any kind of passporting or indicative awards that could allow people to more easily transfer their access to work award.
Anybody else? Anything different to add?
I just wanted to raise the point. I mean, I obviously told our community that I was coming here today, and I've had loads of comments from social media to raise points. One of the strongest points was that people, although it says it doesn't, people still are worried that if they apply for a grant from Access to Work, it will prompt a benefits review, and it puts people off applying for Access to Work. So I just wanted to raise that point.
Any of you familiar with the health adjustment passports that I think have been introduced or trialled recently? Anybody got any feedback on those?
We don't have any feedback. I mean, we're supportive of them, but we don't yet have any feedback on how they're working in practice.
I think we've been told that Access to Work applications have been digitised. I think that's been announced this week. It'd be interesting if anyone has any experience of how that goes in practice. Marcia Cordova.
Thank you, Chair. Good morning, everyone, and thank you all for being here today. So I'm going to talk about disability employment and the disability confidence scheme. So first off, we know that the disability employment gap hasn't really changed for a very long time, and the disability confidence scheme was, I think, first introduced around 8 years ago. So what's your view in terms of the impact of that scheme in its current format, in terms of helping to alleviate the disability employment rate?
From my perspective, it's similar to what other witnesses in previous panels have mentioned, pretty ineffective, to be honest. I think for us, again, similar to the reporting point, if there isn't a degree of accountability for firms or employers who aren't putting in place actions that are associated with what should be done under that commitment, then there's very little real life changes that we can sometimes see being made in the workplace. And I think that's the issue. So long as there's sort of not repercussions for people not upholding their actions under the commitment, there's going to be a limit to how effective it can be, which is what we've sadly seen all too often.
Would that be the case for everyone on the panel then? It is very much like a tick box kind of. There's no accountability.
I think it's a great idea. And I'm sure that some disabled people, I know certainly some disabled people, when they see or they're applying for jobs that the employer is disability confident, it helps. But I just don't think it's been promoted enough, and as has been said, monitored effectively. I think more could be done, basically.
Yeah, so I think there's a particular problem with the committed level, where employers can sign up and they don't have to provide any evidence they're actually doing what they're saying they're doing. It's only really when you get to leader that there's any kind of that kind of accountability. But so I think it's where it's being applied, it's good. And as I've mentioned before, there is a reluctance or a fear about moving to a different employer and how accepting they'll be. So having that badge is a good thing, and having some kind of accreditation system is positive. But I would definitely echo what's been said about particularly that level 1 committed employer. It's largely just a badge on a website.
It's not actually helping to reduce or close the disability employment gap, essentially. because as we've highlighted, you can be level 1 or 2 and not essentially employ a single disabled person, but be a disability confident employer?
I mean, it could be, it should be a great opportunity. You could go to all disability confident employers and you could, get them involved in what we've all been talking about this morning, because that should be our target area in a way. But unfortunately, it's just not more than a badge on the website, as has been said. Do
you think there should be some sort of scheme that employers can, get accreditation for, that would really demonstrate that they are, for the sake of finding a better way, disability confident employer?
Definitely. And I think that it should involve people within the company who are disabled, who can vouch for what that company is doing to support disabled people.
And again, just to raise it's about the language again. This is, again, disability. What about long-term serious conditions, and employers being able to show that they are supporting people with long-term serious conditions and thinking about support plans and so on. So there are good employers out there. Quite often it comes down to a good supportive line manager. A whole company is not necessarily going to be supportive. They may have the right policies in place, but what we hear from people with Crohn's and colitis is it's really the line manager that is key. And if you've got a good supportive line manager, that is what makes the difference. So there are good employers. They're not necessarily carrying the disability confident badge.
Brilliant, thank you. I'm moving on to the work capability assessment. So do you think the government's proposed changes to the WCA will have an impact on the number of disabled people that will engage in work?
From money and mental health's perspective, no. I think what you're going to see is it becoming even increasingly harder for people with mental health problems to get the extra support that they really need. These are people who are not in a position to engage in work preparation or to engage in the workplace yet. The removal of the LCWRA risk regulation is really concerning for us, because the activities and descriptors of the WCA routinely fail to capture mental health problems in particular. And that was a vital protection to ensure that this group can still get the additional financial support they need, but also the protection from conditionality. And so actually you're just creating a more insecure financial base for someone, which is not at all a conducive situation for someone to, at some point in the future, if they would like to or it's appropriate, engage in work. And I think the final point we'd make is, and I know there's been lots of announcements around the benefits space recently, but if there is that shift from replacing the WCA with PIP and having work coaches take more of a role in deciding someone's conditionality and level of support, that's hugely concerning given the mental health knowledge gap that we do know really exists within work coaches.
Yeah, absolutely. I mean, we're hugely concerned about the proposed changes to the WCA, particularly the removal of the mobilising descriptor, which obviously is a particular concern. So by the time someone with MS is needing to apply for universal credit or ESA, because they're no longer able to work, they are usually experiencing quite high levels of impairment, and we just don't think that the greater availability of flexible working or home working compensates for removing that descriptor. We don't think that that's an appropriate, proportionate response to the changes post-pandemic in the workplace. We are already concerned about the long-term impact of putting more conditionality on people who are very, very unwell and are living with a progressive condition where they're not going to recover. People, by the time they reach that stage with MS, are they will have been living with the condition for a number of years, probably decades, and will have acquired quite a lot of nerve damage. There is nothing that's going to be done that's going to return them to kind of being able to work in the way that they previously were. All that will happen is they'll be made poorer and be placed under greater stress.
Yes, I mean, just to add, every time there are announcements like these, it causes incredible fear, panic, anxiety, and for many conditions, that can actually help to make the condition worse as well. We're really concerned about the proposed changes. Already, assessors don't understand what Crohn's and colitis are. They see a young person in front of them who looks healthy, and they assess them based on subjective views. So any changes like that are really concerning to us because there isn't the level of understanding and awareness. And some of the descriptors just don't work. So the toilet descriptors don't work. For someone with Crohn's and colitis, it's not about whether they can get themselves on or off the toilet. It's the fact that they're going to the toilet 20 times a day. Maybe they're getting up in the night 6 or 10 times. So the descriptors aren't working either for conditions like Crohn's and colitis.
Thank you very much. In relation to the kinds of support, so obviously within the job centre, there are work coaches and obviously disability employment advisors. Do you feel that they, in terms of the quality of the specialist support that they provide, do you think it's adequate, and what needs to be done in terms of upskilling their capacity to deliver better for disabled people?
So we see, as I mentioned, a really big mental health knowledge gap for work coaches. There is this training called the Mental Health Behaviour and Relationships Training, which is given to frontline DWP staff, which assists them with how having a mental health problem can affect people. A recent FOI that we've done though shows that only 62% of DWP staff have received that. Their own figures showed that as of February of this year, there was over 20,000 DWP frontline staff who had yet to receive this training. And the way that plays out is really damaging to a lot of the people we routinely engage with. So we've heard of instances where people are pushed into conditionality commitments that are completely inappropriate for them and exacerbate their poor mental health. We've heard of people be pushed into roles which aren't suitable for them and their mental health condition, or to be encouraged to engage in work preparation in a very generic, non-personalised, non-bespoke way, because there is just that gap of understanding among work coaches. So we want to see high-quality mental health training provided to them. But the key point as well is, so long as you have this wider culture within the DWP, which is around essentially making sure people get into work as fast as possible, and that initial movement into work being the key thing, as opposed to whether that's good work, high-quality work, retention, etc., you can have that knowledge among work coaches, but unless they're empowered to use that and to, work in an environment where personalised, less coercive support is encouraged and actively sort of the way of operating, then there's going to be a limit as to how effective that training is.
Anyone else want to come in on that? Or?
If not, that's fine, because we're up against the clock. So, thank you.
Can I just ask a very quick question to
briefly,
Russell?
yeah.
So I have in Stroud, Gloucestershire, we have a really effective and constructive ME group. So when the new NICE guidelines came through, they got in touch with me and I spoke to the ICB, and I was going to write to all the GPs, but the ICB said, don't do that, they're busy, we'll do it. So we know now that, we know increasingly that the interaction between the NHS and the work coaches and DWP is so vital for getting the right kind of approach for individuals. Is there any assessment going on to understand whether the NICE guidelines have been adopted by GP practices all over the country? How are we kind of monitoring that? Because I know how pressured GPs are, and it's not because they don't care, but they've got a lot coming across their desks.
I don't think it is monitored, unfortunately. Implementation of the NICE guideline, or even recognition of the NICE guideline, I just don't think it is monitored. It's we hear from people who's been to the GP, and the GP don't even acknowledge there is a NICE guideline on ME, which suggests they've not even bothered to look at the computer to find it. I'm hoping, as I said, that, the delivery plan from the Department of Health will help to demonstrate that, the NHS needs to look at it, and these initiatives that are coming out will cascade down throughout the NHS. As a charity, we're keenly focused now and putting more resource into local efforts to drive change from the bottom up, as it were, and hopefully we can look forward to a future of better healthcare.
Thank you.
Thank you very much. Neil Coyle.
Thanks, Chair. Can I just ask a quick follow-up to some of the points made about the crucial need to support employers and line managers in particular? Ruth, you touched on line managers. Who is it that should provide that more tailored support to employers and line managers? Is it something you'd like to see DWP do? I personally would have reservations. Is it something that the employers, organisations like FSB or someone should be doing? Or is there a role for rebuilding what the Disability Rights Commission's practice development team used to do? Who is it that should be providing that support? And I assume you're suggesting this should be free support to employers to support their businesses and to support the retention of disabled people in work.
I don't think the government can relinquish all responsibility for training and educating employers and line managers. But what I would say is to work with us in the voluntary sector. Many of us have schemes, education materials, support for employers, and I think there is much more that could be done working with us as patient charities to support employers and line managers. But I think there's definitely a role for the government as well in making sure that people are aware, informed and supported and educated.
Government funded but working with others. Sorry, Russell, you want to come in?
Sorry, yeah, I was just going to say, I mean, there's also a role from healthcare perspective. Sorry to keep bashing on about the NICE guideline, but you know, one of the key recommendations there is that while healthcare professionals are delivering specialist support services, they get to know the patient. They know the patient's abilities, and some of those patients will be in a position to return to work. And you know, the NICE guidelines saying.
I'm talking about in-work support, Russell, rather than returning to work. Very specifically for people already in work.
Right.
Any other thoughts? I mean, if not, then please do feel free to feed in, because I think we've run out of time. So turning then to out-of-work support and its importance to the people you serve and represent, can I just first ask what opinions are on the panel about universal support and work well? Going well?
So it's early days still. I think there are many positive aspects about universal support and work well. For example, we're very happy to see the expansion of IPS through the IPS in primary care scheme. That is something which we look forward to seeing how that is rolled out. I guess the other positives is that there's an understanding of trying to take a more holistic approach to some of the barriers people face to work. So, for example, trying to link people up with mental health support, if that's a barrier, debt advice, if that is another reason why people are struggling to access support. I think what I would say, though, is those schemes as it stands are still quite small scale, and you've seen continuing threats to more specialist disability employment support like the Work and Health Programme, which thankfully is now being extended to 2026, but there's been an ongoing narrative around the threat of that existence. You saw the wind down of the intensive personalised employment support at the end of last year. And more generally, I think what we would especially be concerned about is the fact that Workwell is being used to trial some of those more concerning points that have come under the Back to Work programme. So, for example, the reform of the Fit Note being trialled through Workwell is especially concerning for us. We don't believe that you can go from having mental health or clinical professionals deciding whether someone is fit for work or not to non-clinical members of staff having that say. And overarchingly, they come under this Back to Work plan that on the one hand provides support and personalised assistance into work, and on the other very much bangs the drum of sanctions and withdrawing any assistance from people. So I think so long as you are trying to dress support up in more punitive measures, there's a very big contradiction there, which we're really, really concerned about, given the known mental health and financial impact of sanctions.
And you're involved in the pilot?
No. We've been watching.
Not even as a stakeholder engagement exercise on the part of DWP? They're not talking to you about how the pilots are working? On
universal support and work well, no. We at Money Mental Health have not been engaged in those conversations.
Who is DWP talking to?
Not sure.
Fascinating, something to come back to. Sorry, and any other views on universal support or work well?
I think the key thing for us is the scale of both programmes. I think universal support is probably less relevant anyway for people with MS, just because of what I've already described, that by the time they're out of work, they probably wouldn't be qualifying for that. With work well, I think it's 59,000 people in the pilot. When I looked at the criteria, it could capture people with MS, but it's much more likely to skew towards people with mental health conditions and musculoskeletal conditions. So that's kind of one of the main problems. And then to echo what Becca was saying, is there's a lack of trust, I think, amongst a lot of disabled people about what's actually underpinning both those programmes.
There's issues around the scale and reach so far. Is there an imbalance between the timetable and reach of the support programmes that are meant to be helping disabled people to work and the drawback of other help? We've already seen DLA abolition, and now we're seeing PIP being... Is there an imbalance there in how DWP withdraws support before delivering things like we already talked about, access to work and promises that have been committed to for many years, more than a decade?
I think the perception amongst people with MS at the moment is very punitive. So the changes to the work capability assessment being followed by a green paper on PIP, which have some very damaging proposals in them, things that are causing, we've had people calling us saying that they're literally sick with fear about what's being proposed. I think the problem is there's a narrative around being quite hard on people who are out of work, tackling out of work benefit bills, of which PIP is not an out of work benefit. It needs to be said. The issue is, and this is something that we raised with the previous disability minister when the WCA consultation was live, is that there's huge numbers of people that would be effectively collateral damage in these proposals, and it does nothing to actually address any of the issues that Becca's already identified around increase in people who are out of work or struggling at work due to mental health conditions. We would advocate much more for support to keep people healthy, prevent people becoming unwell, keep people in work for longer as a measure to tackle the problems that we're facing economically.
Any other thoughts about making sure the commitments to support disabled people in work are actually being delivered before further cuts are made?
I think that's really important. I mean, sanctions don't work. Most people with long-term conditions want to work. They're keen to get back to work or stay in work. And I think some of the language and terminology has been really damaging. People with Crohn's and colitis report to us regularly that they get abuse from members of the public for using disabled toilets. And I think it just helps to foster this sort of sense that people with disabilities or long-term conditions are making it up, and that they're not suffering conditions that are having severe impact on their life. So I think all the talk of sanctions has been hugely damaging. People call our helpline. As soon as there's an announcement, we get a spike in calls, people feeling suicidal, people who've managed to get support feeling they're going to lose it, and people who've been trying to get support feeling that there is literally no hope for them.
And do you tell people who call your helpline, if I may, Chair, the people who are calling your helpline and organisations who are very worried, you are telling them that legislation to deliver on this has not yet appeared and there is very little time to get that through despite the lack of an agenda from government at the moment?
Yeah, so we've made the point to the Secretary of State that, that is true, but a disabled person who is hearing about this in the press doesn't necessarily know the difference between a green paper and legislation or what's actually going to happen next week.
Of course. Thank you.
Thank you very much. A moment ago you said something in passing which I didn't know, which was that the work and health programme has been extended to 2026, and we've just checked and that has been announced. I'd missed that. So thank you for giving us that welcome news. We're grateful to all of you. Thank you very much for helping us this morning.
Thank you very much for inviting us.
That concludes our first panel. Thank you, Russell, as well, for being with us remotely.
Thank you very much.
I loved your line.
The proceeding is currently suspended. 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 The proceeding is currently suspended.
Order, and welcome to our second panel this morning in our inquiry on disability employment. We're very grateful to you all for being with us. And can I ask each of you to tell us very briefly who you are, starting with Alison Thwaite.
Hello, good morning. My name is Alison Thwaite. I'm the Employment Development Manager for the Down Syndrome Association's WorkFit programme.
Thank you. Georgia Harper.
Hello, I'm Georgia Harper and I am Policy Manager at Autistica, the UK's leading autism research and campaigning charity.
Thank you. Evan John.
Hi, I'm Evan John, Policy and Public Affairs Advisor at Sense. We're a national disability charity that supports the UK's 1.6 million people with complex disabilities.
Thank you all very much for joining us. And can I put the first question to you the same as I put to the previous panel, just to ask each of you to tell us what you see as the main barriers to work for the people that you're supporting, and whether things have changed very much, for better or worse, in the last few years. Starting with Alison Thwaite.
We support people who have Down syndrome to live full and rewarding lives. The population of people who have Down syndrome in the UK is just under 40,000. Only 4.8% of people with learning disabilities are in employment, so we are very passionate about supporting people with Down syndrome to be able to fulfil their potential and their career ambitions. One of the main barriers for people with Down syndrome is in education, a lack of high quality work experience. We are looking for education providers to set a presumption of employment for people who have Down syndrome, and we want them to have access to high quality opportunities. We want them to be able to be prepared for that transition into adulthood and be prepared to join the workforce. So that's one of the key barriers. I also think with employers there can be a lack of flexibility. We've talked, the previous panel have talked about reasonable adjustments. They are so essential, and there's this perception often that reasonable adjustments will be challenging, they will be expensive, they will be difficult to implement. So we spend a lot of time working with employers in the WorkFit programme and helping them to understand that reasonable adjustments can often be very simple and straightforward, and we support them to implement whatever they need to do in the workplace. There tends to be a recruitment process that's technology driven with a lot of employers, especially the big employers. They want very efficient, effective recruitment programs to bring their talent in. That often doesn't work for people with learning disabilities. We focus on a very person-centred approach when we develop opportunities with employers. So we want them to sort of strip back all of these assessment days and telephone interviews and things like that that just wouldn't work for people who have learning disabilities. Also, we wonder about the lack of understanding that we see around the Equality Act 2010. Sadly, we still get some employers who contact us who want to develop an opportunity, but then say, oh, well, how much should I pay somebody who has Down syndrome? And we say, well, you'd pay somebody the going rate for the job that they do, as you would with anybody else in the organisation. So I think there's certainly an education piece there around helping employers understand the value and the contribution that somebody with a learning disability can bring to the organisation. A lot of that is around perception, and sometimes employers see people with learning disabilities as a risk rather than an asset to their business. But we want to change those perceptions if we can.
Are employers more open to this than they were 5 or 10 years ago? Or
Absolutely, yes.
They are.
In the last 3 or 4 years, we've seen a huge increase in the number of employees that are coming to us. We provide a lot of support to employers. Literally, we hold their hands from day one, carving a role, giving them resources, training them, and then our support is ongoing for as long as that person is with that organisation. That could be 12 months, 12 years, whatever it would be. We pledge our support is ongoing. So it's, but we have seen, 2021, 22 financial year, we saw a 4-fold increase in the number of employers coming to us to say that they wanted to work with us. So it's very positive. Yeah.
Good, thank you. Georgia Harper.
Thank you. So in terms of autistic people, prevalent statistics vary, but we think there are about 1 million autistic people in the UK. And the employment stats, unfortunately, are pretty dire across the board. The latest government statistics we have show that 3 in 10 autistic people are in work, which is the worst employment gap of all disability groups. Even at graduate level, these gaps persist. Just 4 in 10 autistic graduates find full-time work within 15 months, compared to 6 in 10 non-disabled graduates. And again, in terms of whether that is a permanent contract, whether the role is at the person's qualification level, it's, the statistics are quite dire on that. In terms of the main barriers, Some of these are wider issues. In general, getting even a diagnosis is very difficult. At the end of December 2023, there were 172,000 people on the waiting list, which is about the population of Oxford. Waiting lists that are years long are not uncommon, and for those who do get the diagnosis, it's often the norm to kind of be sent away with a leaflet or a website. The end result of this is barriers in education, which has a knock-on effect, quite high rates of mental health conditions, which, as you just heard, has knock-on effects for employment. And then in terms of the career pathway, work readiness is often not necessarily thought about. Too often autistic young people are assumed to be incapable or assumed not to need support, which is not true. As we can see, even at graduate level, even amongst autistic people who can access education, they are not necessarily able to access employment in its current form. Things like poor accessibility of transport and housing for people who might really struggle with sensory overload can then very much limit your options, particularly when flexible working isn't there. In the Buckland Review, we supported, support Buckland's review of autumn employment, which was published in February. Lack of confidence was a very big thing, both for autistic people because of the past negative experiences they've faced, but also for employers. Again, there's this assumption that reasonable adjustments are complicated and so on. Application questions are often very unclear. Job descriptions are often unclear, and they might automatically include things like team player, which could put off an autistic person even when that's not necessarily necessary for the role. As Alison was saying, forms can be inaccessible. About a third of autistic people do have a learning disability, so some of the same barriers apply. Things like psychometric tests and sort of increasingly the automated screening processes that large employers use often just screen out things that aren't phrased in the correct way that autistic people are not necessarily directly told about. Job interviews are often more of a test of adherence to social norms and verbal competence under pressure than ability to do the role. Questions often have hidden meanings. Our research has found that autistic people rate their experiences of interviews as significantly less positive than non-autistic. And then, as we'll come on to, getting into the work, there's then difficulties with the sensory environment, with discrimination, with, again, those kind of unclear social expectations, and often the onus is on the autistic person to identify and ask for adjustments.
And Evan John.
Yes. So, as I said, we support the 1.6 million people with complex disabilities in the UK, and we define complex disabilities as somebody who has two or more of conditions like blindness, having hearing loss or hearing impairment, or deaf, or have learning disabilities, or are artistic. So if they've got two or more of those, then they have a complex disability. And obviously that's a really broad category, but people with complex disabilities often face really high barriers to work. So our research has found that 82% of people with complex disabilities are unemployed, compared to 23% of non-disabled people. And only 13% of people with complex disabilities are in full-time employment. And it is important to say that while this inquiry is obviously about disability employment, not every person with complex disabilities will be able to enter work in the future. It might be the case that in the long term that might be an aspiration, but not now, or it might be that it will never likely to be an aspiration for them. But of course that is something that that is okay, and we shouldn't demonise people who cannot work. I think it's in terms of the barriers that they face, these barriers do start early. Our education system often doesn't have high aspirations for disabled people, and particularly people with complex disabilities. It means that people don't get the right specialist career support, and so they don't necessarily know what opportunities are out there. They don't necessarily know what support is available for them, and that has an impact when they start looking for work. In terms of the other barriers, then obviously society's attitudes to disability is a big one. Unfair recruiting practices, as Georgia has mentioned, and a lack of suitable job opportunities. And also, when people get into work, there's a failure to provide people with the support that they need. we found that 44% of employees with complex disabilities have been bullied or harassed in the workplace. And 1 in 10 people with complex disabilities in work have told us their employers aren't willing to make reasonable adjustments, and clearly that's a requirement under the Equality Act. And one issue then is that people with complex disabilities aren't getting the specialist support when they are looking for work. Our research has found that half of job seekers with complex disabilities say they don't have the support and equipment they need to look for work. And over half of people with job seekers with complex disabilities say that they don't feel supported by their work coach. 46% say they don't feel supported by their disability employment advisor. And this isn't surprising given we know that there's very limited covering of disability in the training for work coaches. And finally as well, job centres don't even have assistive technology that lots of disabled people need to use computers. So for example, somebody who is blind may need a screen reader to read, to be able to fill in a job application online. As things stand, a non-disabled person can walk into a job centre, use the computers on site to apply for a job. Somebody who uses assistive technology can't do that. And that's why Centre's calling for every job centre in the country to be equipped with assistive technology, which we think would cost around £5 million.
Thank you very much indeed. Sir from Swain.
I asked the last panel if it was a problem that the employment disability statistics which inform government policy are reliant on self-declaration. And they thought it was. So my question to you is, unless you disagree with them, what can we do about it? Is there a solution to be had that isn't overtly intrusive, bureaucratic, and at disproportionate cost? In any order, but don't all speak at once.
Well, I think for people who have Down syndrome, that is a diagnosed condition that, there's not a situation where somebody goes to a job interview and doesn't declare the fact that they have Down syndrome, because we support that process. So we have a person-centred approach where we talk to an employer on, an individual level. For imagine, if we work with a big hotel chain, we talk to that hotel manager, and a work officer builds a relationship with that hotel manager, and we talk then about a candidate that we know very well, that we've spent a bit of time with, that we've vocationally profiled. So it's a very person-centred, one-to-one approach. And of course, we disclose that we are wanting to develop an opportunity for somebody who has Down syndrome. So it's a very open process. There's nothing that has to be disclosed, because we've already disclosed that, and with the permission of the candidate we've also disclosed any additional health conditions or preferences that they may have. So that's the position.
It doesn't apply.
The DSA. So I will hand over now.
In terms of autistic people, we're certainly very grateful that in recent years autism has been included in the labour force survey, in the annual population survey. That has given us statistics that we haven't really had, and has highlighted again some of the amongst the worst gaps of all disability groups. So I definitely understand the importance of data. However, I would agree with the previous panel that there are potential issues in terms of undercounting. There is, as you mentioned, the issue of people, for very understandable reasons, choosing not to disclose, and that will always be the case. Our research has found that about 1 in 10 autistic people who are in work do not disclose to anybody at work, and only about a third are fully open to everybody in their organisation.
What's the answer? Is there one?
I think, honestly, you're not going to be able to get, there are always going to be some people who choose not to disclose. There are things you can do in terms of, as I mentioned, the assessment crisis. Actually getting more people diagnosed would go some way to address this. But otherwise, I think it may just be about having that awareness that any statistics we collect are likely to be an undercount.
Yeah, I think, like what Alison was saying, a lot of the people we support would have diagnosis, so I don't think self-identification would be much of an issue for us. So yeah, it's not something we would necessarily have a strong opinion about.
Thank you. Okay. Very much. Celine Saxby.
Thank you and good morning. Some of the barriers such as transport, network and access to NHS treatment do vary across the country.
for example, in rural communities like my own or more deprived areas. Do you think we pay enough attention to this point?
It's certainly a factor for some of the people that we work with in terms of travel training, transport to work. Access to work is a great resource. We're a huge fan of that in terms of people being able to access support to get taxis to and from work, certainly for the group that we work with. So yes, if there was anything that we could be done to enhance services in rural areas, we'd absolutely welcome that.
Thank you.
Yes, I'm inclined to agree with you that it is something that often gets overlooked. Certainly in terms of assessment waiting times, we know that is a huge postcode lottery. We're in the process of obtaining freedom of information requests, which so far show that the median waiting time for children ranges from 3 to 5 months up to 4.5 years, and for adults from just under 6 months to up to 5 years. So real variation there. In terms of some of the other barriers, particularly, I know we're going to come on to remote working a bit later, but particularly in sectors that are kind of concentrated in London and other big cities, where housing is very limited and, living in close quarters with strangers is often expected, that can be very, very difficult for autistic people. And then that, again, can limit your options.
Thank you. Evan, anything you'd like to add?
Yes, I think one important thing to say here is the role of social care in supporting work. So we've found that 1/4 of people who are with complex disabilities who receive social care need it to go to work, to volunteer, or to take part in educational training. And that can include informal support, but also includes formal support from social care services. Now, obviously, as things stand, social care is under a huge amount of pressure. And if you're in work and you draw on social care, what you need is consistency. You need to know that the person will arrive at the right time so you can get to work on time. But actually that, in a situation where there's a staffing crisis, that often doesn't happen. And so last year we found that over the previous 12 months before the research was carried out, nearly 1/3 of people with complex disabilities who use social care had experienced staff shortages, and 1/4 had experienced cuts to services. Now, naturally, that is quite possible that's having an impact on somebody's ability to work.
Thank you. And there's currently a campaign to allow blue badge holders to use e-scooters and other such electric vehicles on the road. Do you support this campaign?
I think it's probably less relevant for the cohort of people that I work with, so I'll let the others answer.
Who's running that campaign?
Again, it's not something, I'm not familiar with the detail of it. Certainly we know that, again, autistic people often struggle to access things like blue badge support in the first place as being a hidden disability. But yeah, I'm not familiar with the detail of the policy.
Yes, same. It's not something we've really worked on.
Thank you. The government is saying that there's a rise in remote working, making it easier for some disabled people to work. Do you agree with that? And are there enough of these jobs to really make a difference on the disability employment rate?
People who have Down syndrome, remote working is not usually an option. They need to be in the workplace with workplace buddies, and that's a scheme that we support, so that they have that interaction on a regular basis. They have somebody there doing their training in person, face to face. They have somebody there as a workplace buddy supporting them, helping them to grow in confidence and be more comfortable at work. So remote work, and we do have a very small number of people who do some assembly work at home, and we have a young man who does accessibility testing on websites for people who have learning disabilities. But generally, working from home is not an option for somebody who has Down syndrome.
In terms of the people we support, remote working it's a bit of a mixed bag, essentially. It's an absolute game changer for a lot of autistic people, again, particularly for those who struggle with the sort of busy, noisy open plan offices, but it really isn't suitable for everyone or, as the previous panel said, for all sectors. Some of the advantages are, again, being able to control your sensory environment, being able to avoid a potentially inaccessible commute, being able to avoid distractions, being able to avoid having to mask your autistic traits all day. However, it is hard to find fully remote jobs these days. Some employers are willing to make adjustments, but jobs are often still advertised as in a location, and even the words flexible and hybrid, people have very different definitions of what those mean. And again, autistic people will tend to take things literally, and if a job is advertised in a way that is not accessible to them, are more likely to think, well, it's not for me, rather than doing what is perhaps expected but not necessarily made explicit, which is that you have to ask and negotiate. And remote working is not a magic wand. There is still a lot of social interaction, even if it's over video calls. That's still social and that can still present challenges. It doesn't remove other challenges that the person might face, for example, anxiety around uncertainty. Some, as Alison said, find remote working and online communication platforms very, very difficult, particularly those who have learning disabilities or those who speak few or no words. And as the previous panel said, it also is not feasible in a lot of sectors. If you're a bus driver, you can't work from home. And that is true of many entry-level jobs. Things like, retail and hospitality is how many people, not just disabled people, get their foot in the door, and we also need to work to ensure that those sectors are accessible so that disabled people have a chance to get their foot in the door, essentially.
Yeah, I'd agree with everything the panel has said so far. I think some of the discussion around flexible working and remote working has perhaps already oversimplified the barriers faced by people with complex disabilities. And I think the characterization that we've seen of a transformed world of work is perhaps something that disabled people themselves wouldn't recognise. Working from home isn't a panacea. For lots of people, it actually doesn't address any of the barriers they face. For example, negative attitudes. That's something that's not going to be changed by somebody working from home. It's true that for some people with complex disability, the growth in working from home has been a game changer. But disabled people are varied, they have very different needs, and I think working from home really isn't the answer to loads of people's problems. And actually, the Institute for Fiscal Studies have concluded that it's not actually clear that disabled people have particularly benefited from the shift to home working. And true. The ONS has found that disabled employees are only marginally more likely to work exclusively from home, and actually half of disabled employees say they can't work from home and they have to go physically into a workplace. So I think really it's not the answer. It's definitely something we should encourage, but it's not something that is the answer. And definitely what we'd want to avoid is a situation where employers abdicate their responsibility to make a workplace accessible, because if the default is for disabled people to work from home, that's a problem on two counts. Firstly, the loneliness and difficulty building relationships is a huge problem for disabled people. Going into the workplace has much wider benefits than simply doing your job. It allows people to build relationships with other people, and we think disabled people should have the opportunity to do that as well. But secondly as well, employers do have a responsibility to make their workplace accessible to disabled people. And if we would be worried if employers were telling disabled people, rather than we're going to install a lift, actually you can work from home instead. So it should always be a choice for disabled people.
Thank you, Chair.
Thank you very much. I'm going to change the order slightly here and bring in Debbie Abrahams.
Thank you very much.
Debbie has to leave a bit early.
Could I just ask a question which is flipping this on its head a little bit? So the focus, I think, of the inquiry has been around what the social security system can do and individuals can do to make themselves more employable. But I wondered, based on what you have said, is what we need to do to enable employers to be more supportive. Is this a cultural change that we need to try and encourage? And what would that look like? For example, are you talking with any of the employment organisations like the FSB, Federation of Small Businesses, or the CBI for the larger organisations, to proactively look to how we can change attitudes of employers towards disabled people?
Yeah, we've had some contact with different organisations like that, and what we tend to get is a very positive initial response, but then not everybody then follows up with that. What we are looking for at the DSA is employers who are committed to doing this because they understand that a diverse workforce is a strong workforce. That's really important that we get that message across. Some employers, and I know we'll come on to the mandatory reporting, we don't want to work with employers who are doing this because they feel that they should. We want employers who are genuinely interested in welcoming a diverse range of people into their workforce. So while in the past we've done networking with different business organisations, we now tend to focus more on employers, and what we've got is a very strong network of employers where word of mouth has been a huge thing, where they've talked about having an experience with WorkFit that's gone incredibly well. That's spread throughout the organisation, and if they're a national organisation, other branches then get involved and say, we want to do this, we've seen this success story. So for us, it's a lot of word of mouth, sharing our success stories on social media, letting people see what we can do. You know, we provide an awful lot of support to employers. It's all free of charge. Everything is funded through the Down Syndrome Association as a charity. So I think that's more powerful to us, to be honest, rather than going through the business networks. Yes, we can raise awareness, but what we've got is a fabulous group of employers that we work with who are doing that on our behalf and, you know, nominating us for awards and various different things. So,
thanks, Alison.
Yeah.
Georgia?
Thank you. So first of all, again, we supported recently on Sir Buckland's Autumn Employment Review. So I would signpost there for a series of recommendations for employers and the government. Beyond that, I think there is a need for a culture change, and in particular, and this is something that we talked about a lot in the review, universal design. Rather than waiting for somebody to come forward with a diagnosis, think about what we can do in general for all employees to make work more accessible to all. Of course, there will always be a need for individual adjustments. I know we're going to come on to that later. So that can include, again, changes to the sensory environment and considering alternative methods of recruitment. In terms of looking more widely, the government has a real opportunity to lead by example. We'd like to see more, I mean, we're a research charity, but we'd like to see more pilots of sort of best practice and have, you know, government working with employers of all sizes. We've had some good initial conversations with Recruitment Employment Confederation and ADECO on that, on the recruitment side. Echoing what the previous panel said, work coaches don't necessarily have a good understanding of autism and neurodiversity, so we would like to see more training in that area. And again, picking up on something that Alison said earlier, there's sometimes a lack of clarity in the autistic community around autistic people's position under the Equality Act 2010, because not all autistic people identify as disabled. So we would love to see more guidance in that area.
Thank you, Georgia. And Evan?
Yes, I think there are a few things. I've said before that 44% of our employees with complex disabilities experience bullying and harassment in the workplace. So clearly there is a problem with attitudes towards people with complex disabilities, and employers need to do more to make sure that workplaces are inclusive of disabled people. Also, as I've said, there's not all employers are willing to make reasonable adjustments. 12% of employees with complex disabilities say actually their employer hasn't been willing to make reasonable adjustments. And I think one thing that's also worth talking about is progression as well as retention. I think sometimes there is the perception that you get the disabled person into a job and then they're happy to be there and they stay. Actually, disabled people, they have aspirations, they have training that they want to contribute to a workplace. Our research has found that half of people with complex disabilities in work have taken a less challenging job because their needs haven't been met as a disabled person. So clearly employers need to do more to recognise what people with complex disabilities bring to the workplace and how they can progress in that career. And finally, on the point about working with employers, this is something that SENS does a lot at a local level. So for example, we have an employment service in Birmingham and also in Loughborough, and today we've got a Pan-Disability Jobs Fair where people from across the country are coming to visit employers and speak with them about jobs.
Fantastic. Can I just ask you now, in terms of if you could make them brief answers, in terms of the out-of-work employment support that members of your organisations access, how do you think those are going?
Should we start with Alison again?
You mean like support from Job Centre Plus and things like that? Or?
Yes, and the Work and Health programme, that sort of...
Yeah, I can keep that very brief. The cohort of people that we work with don't tend to access the Work and Health programme, the Work Well, anything like that. I'm not aware of anybody with the group of people that we work with who's had a job opportunity through Job Centre Plus. Okay. We did actually develop a work opportunity in a job centre where somebody went in and did an admin role for 3 months, and she did very well, but unfortunately there wasn't a vacancy at the end of that. So in terms of Job Centre Plus, it's not something that our candidates have had a lot of exposure to, and they've not had any sort of outcomes that I could really share with you. Yeah.
Thank you, Alison. Georgia?
In terms of job centres, National Autistic Society recently piloted their autism accreditation framework, working with DWP in a limited number of job centres, and I think the intention was for the government to roll that out, but we're still waiting for an update on that. Yes, we'd welcome news on that side. In terms of wider support, again, what we heard in the Buckton Review was a bit of a mixed bag, particularly, again, around sort of understanding of autism from work coaches, that sort of thing.
Thank you.
Yeah, so I'd say it varies, and I think there will be some people who've had a really positive experience of disability employment advisors and work coaches, but that's not universal. And as I said earlier, over half of job seekers with complex disabilities don't feel supported by their work coach, and that's a big problem if you're trying to support those people into work. And similarly, 46% of employees with complex disabilities don't feel supported by their disability employment advisor. So clearly, if they're meant to be the specialists, that is a huge problem. And I think one of the reasons for that is training that doesn't cover things like disability equality in, for example, in work coaches. And I think there needs to be a lot more. I've got the training guide here for work coaches and disability employment advisors, and the topic guide doesn't mention disability for work coaches. A lot of the focus is on complex needs, which of course is great, but actually, if you're supporting somebody who has complex disabilities, you need to understand the barriers they face. And while we have been working with the DWP on this, from what we can see, there really isn't enough training for work coaches.
Thank you. Can I just add, a number of job centres have reached out to us and asked for us to do training for them, which we're absolutely happy to provide. So we are working with them, but I think for a lot of those DEAs, being able to signpost to a specialist provider like the Down Syndrome Association is a good way to go, because we probably can't expect them to have that breadth of knowledge about all the different disabilities that are out there. So we're very happy to provide that service. Yeah.
Thank you very much.
Thank you very much indeed. David Linden.
Very brief. First question, how many disability employment advisors have a disability? Do we know that?
We did a parliamentary question on this a while back, and I can't remember off the top of my head, but from what I remember, actually was about in line with the population. We were quite surprised.
Okay, right, interesting. Right, the main question that I want to ask is about how do we... So, yes, we've done some really good work in terms of getting people with disability into work. How do we sustain that? One of the things we've spoken about is reasonable adjustments. So, if you have Down syndrome, you're autistic, or a sensory impairment, what kind of reasonable adjustments help the groups that you're representing today, and how willing are employers to make them now? Evan, I know you mentioned earlier on that 12%, I think was he said, had refused them. Can you just give the committee a bit of a flavour of the kind of reasonable adjustments that we would expect employers to make for somebody, start with Down syndrome?
I think the main one is flexibility. So we encourage them to be very flexible around shift patterns, break times, considering how somebody's going to travel to work. We help them with job carving, so we might look at all of the different entry-level jobs in a particular team or area, and we might help them to carve a role. We would take elements from different job descriptions and say, let's bring this together in a new job description. Let's look at the number of hours that somebody can work. The majority of people who have Down syndrome wouldn't initially be able to work 16 plus hours. So we might say, let's start with one shift of 4 hours, and then over time let's increase it to 2 shifts or 3 shifts or whatever somebody is comfortable to do. As that person becomes more and more confident in the workplace, we can increase increase in line with that. So it's really about them being open to suggestions, and they're very often open to our ideas about reasonable adjustments. We might say, if somebody has limited verbal skills, do they need some kind of communication tools? Might they have communication cards, or anything? Do we want to do a checklist for them, timetable? There are so many different reasonable adjustments that are very, very simple and straightforward. We can provide them with all of those templates and the information, and work with them to create that, and work with their designated work fit officer to do that. So it's really about just being open and flexible to things. We'd have them do a site tour rather than a formal interview. We know people with learning disabilities feel very pressured and don't respond well to a formal interview process, so we say, well, why don't we have somebody come in and just have a wander around and look at the different jobs on site, and people relax, so you can have a casual chat with them. Mum or dad will usually come along, as well as the work fit officer. It's just about getting them to think differently, but more importantly, to see that person as an individual. Everything that we do is person-centred. It's about that employer talking to that individual, making a connection and understanding what they need, and then for that employer to think, how am I going to get the best out of this person? Everybody has skills, talents and abilities, so how am I going to get those skills from this person and make them an asset in my organisation?
Ms Harper, can you talk about reasonable adjustments that we would expect employers to be making for autistic people?
So for autistic people, it does vary quite a lot. One thing I will say before I forget is, in our research around disclosure of the autistic people who have disclosed that they're autistic to their employers, the most common time to do that is after you've started the job. So again, that's just to emphasise the point around making particularly the recruitment process accessible without waiting for someone to come forward. Reasonable adjustments, again, flexibility is a huge one, potentially providing or allowing the person to use sensory aids, things like noise cancelling headphones or sim toys, having a fixed desk if it's an organisation that usually rolls around hot desking, having maybe instructions provided in writing, meeting agendas given in advance, perhaps interview questions given in advance for recruitment. And I saw the other week that John Lewis have announced that they're doing that, which is really welcome. But often it's things that are not complicated or costly. Despite this, though, many are denied adjustments. There's still a bit of a stigma around requesting adjustments. Of the survey we did, around a third of autistic employees did not request adjustments but would have found them useful. As I mentioned, there's often a bit of confusion around the Equality Act and whether, for autistic employees, people might not be sure that they count, for want of a better word, and are allowed to ask for adjustments. There's people fear, repercussions. Sometimes the pathway for asking for adjustment is unclear. Sometimes there's a lot of worry about a perceived detrimental impact on others. And of those of the autistic employees who did request adjustments, over a quarter were refused, and more than 1 in 10 told us the adjustment was poorly implemented, i.e. it's something they had to sort of keep fighting for. As the previous panel mentioned, sometimes this is reliant on individual line managers, and when they move on, you have to start the fight all over again.
Okay. And finally, Mr. John,
I agree with everything the panel have said so far. I think one thing to bear in mind is that there are often external factors that will actually constrain whether somebody can make reasonable adjustments. And I'm thinking particularly of access to work. So the best employer in the world can want to put everything in place for their employee, but with the access to work backlog at I believe about 25,000, then actually that means that some people are having job offers withdrawn. So I know we'll get onto that later, but it's also a matter of whether employers actually can make those adjustments.
We're going to do a very quick question. If I can just get a yes/no answer, because I know we're really up for time. I don't want to upset the chairman. Do you support the introduction of mandatory disability workforce reporting for large employers? Ms. Thwaite?
No.
Ms. Harper?
In theory, yes. We've seen how disclosure is difficult.
Okay. Mr. John?
I think we're in favour of anything that improves transparency and helps companies to hold companies to account, but we don't have a strong position on whether it should be mandatory.
Thank you. I appreciate that. Short questions that I do like committee, but in the interest of time. Thank you.
Thank you. Nigel Mills.
I think we just got to access to work, so maybe tell us your thoughts on how well it's working and what should be changed.
We find access to work is incredibly helpful. The majority of our candidates would use it for taxi costs for them to get to and from work. A lot of people who have Down syndrome may not travel independently, or they may need time to learn a bus route or a train route or something like that. So having that taxi service initially is hugely beneficial. We don't use job coaches at WorkFit. We ask employers to designate 2 or 3 workplace buddies in the team to support the person, and I think initially employers are a little bit daunted by that, but then we can reassure them that we provide the training for that. So very few people using WorkFit apply for job coaches, so I couldn't really comment on that. But generally, as a concept, access to work we are huge fans of. I think the online portal is making a big difference in terms of the speed of processing applications, because as we all know there is a bit of a backlog there, so it's very positive that that's been changed. One thing I would say is, in terms of having to reapply every 3 years, for somebody who has Down syndrome, their diagnosis won't change, so if we could possibly remove the need for them to reapply, that would be helpful.
So in terms of the people we've spoken to, I would say, very much echoing the previous panel, access to work is generally viewed positively when it works, but not enough people know about it. Awareness is very, very poor, and often the initial setup is often quite difficult, is not necessarily accessible, and as you've heard, there are long delays. I know that there have been recent announcements around enhanced access to work packages, and in particular access to mental health support through access to work, which is particularly welcome. Autism is not a mental health condition, but 8 in 10 autistic people do experience mental health conditions, so that could be particularly beneficial for our group. But mental health support is often quite patchy for autistic people, and sometimes the traditional approaches need to be adapted, so it will be interesting to see how those changes can be made once we get the detail on that.
Yeah, I agree with the things that the panel have said so far. Unsurprisingly, we think that access to work is a brilliant scheme. It's a real enabler of work for a lot of people with complex disabilities, but not enough people know about it. Our research has found that half of job seekers with complex disabilities don't know about access to work, and so that's quite a big problem. Another thing we'd say is recently access to work has been digitalised. It's quite a new thing, but I was speaking to my colleague who's deafblind yesterday, and he was saying that it's completely transformed his experience. It used to be the case that he the application form and his claim forms were all paper, which meant that his supporter then had to do everything for him, copy receipts, sign things, because he wasn't able to as somebody who was blind. Now he can do it completely independently over the computer, so it's made a huge difference to him.
And have you got any experience of the new health adjustment passports? Have they made a difference, or have you not seen them yet?
Don't have a lot of experience with those, though.
No, we don't have much experience, but yeah, anything that helps people get the reasonable adjustments is a positive thing.
Thank you very much. Marcia de Cordova.
Thank you. Good morning, everyone. So what impact has the Disability Confidence Scheme had on the disability employment rates?
Well, my understanding from recent research is that it hasn't had much of an impact, sadly. I think it's a great concept, it's a great scheme, and a lot more could be done with it. It perhaps needs a little bit more bite, a little bit more accountability. I think generally it's welcomed, and as I say, it's a great idea, but it needs a little bit more depth.
Yes, I would agree. Disability confident in terms of stakeholders we spoke to through the Buckland Review, it's fair to say was viewed perhaps less positively by autistic people and employers alike. It's often seen as a bit of a tick box exercise that does not necessarily translate into the practical changes that the scheme intends. As Alison has said, it does not necessarily translate into employment of disabled people. The Buckland Review did recommend increasing the rigour of the assessment and developmental work needed to achieve those higher levels, which we would support. I understand that the Disability Confidence Scheme more widely was under review, so again, I look forward to seeing any updates that come out of that.
Yeah, we'd agree. Again, what we hear a lot from disabled people is that it is seen as a tick box exercise that doesn't often have any meaningful impact for disabled people. So I think, as the panel said, really there's a lot of self-assessment in the current scheme, so employers can say a lot about what they've done in terms of disability confident without actually employing disabled people or providing evidence of those changes. So we're in favour of making the whole process more robust, and to make sure that any review is not just focused on employers, but to make sure it's informed by the experiences of disabled people and disabled employees.
And to overcome kind of that self-assessment approach, would you see some sort of independent evaluation being a better approach?
Yeah, I think that would definitely make a difference, because at the moment I think it's at level 3. It's another level 3 organisation carries out the audit process rather than...
Independent,
Yeah. So yeah, we would agree with that.
I should say on the neurodiversity front that Autistica are currently in the process of launching our Neurodiversity Employers Index, which does aim to provide essentially a framework for assessing and becoming more accessible to neurodivergent employees or would-be employees. So that is currently open for that is currently open for employers to sign up to with the launch in the summer.
I think for employers as well, we talk about diversity inclusion a lot. And I think what we should be talking about is diversity, equity, inclusion and belonging. We need to expand all of that and help employers to understand those concepts.
Thank you.
Thank you very much. Siobhan Bailey.
Thank you, Chair. I'm after opinions of programmes that were announced last year. This year, where are we? The spring budget.
This year and last year, right? Wasn't it? Yeah.
This year and last year. They're about universal support and work well. So your experiences, your opinions, your involvement even.
I think I would say we haven't had much experience of it. But we support anything that means that disabled people get more support to find work. But I've already highlighted how a lot of work coaches actually don't have the skills they need to support disabled people. So while we support, for example, work coaches having more time with disabled people, if there isn't a change in the training, then that's not going to have the impact that it could do.
Likewise, I don't have a lot of direct experience with this. Autistica are a research charity. We do not directly provide services, which is why some of the more practical experience is limited. Universal support, I think, was announced by the time that the Buckland Review is being written up, so there is a recommendation in there to ensure that meets the needs of autistic people, perhaps including supported employment. What I would say in general, and I know we're going to potentially come on to some of the benefits changes in a minute, is that unfortunately the government has a bit of a habit of framing punitive measures as support, and that has the effect of creating distrust that makes it quite difficult then to actually encourage people to apply for the support that is there. And I know that that was mentioned in the previous panel regarding access to work. So that's sort of a more general point, but yeah.
So is it kind of wraparound support with the universal support?
Well, what tends to happen with people that are members of us, they've been through Job Centre Plus, they've been through various government schemes and departments, they come to us, ideally they get a permanent paid job with us, and 92% of the people that get jobs through us stay in work, so our retention rates are really good. So the people that we work with get to us and then don't tend to be looking for anything else because ideally we found them the job that they want. So
is it your view that for Down syndrome specifically, it's more third sector organisations that are sort of the thing that's making the difference rather than perhaps the Job Centre or DWP?
I think the fact that we're a specialist provider makes a huge difference. We place people into, we've just gone to 80% of private sector. So 80% of our jobs are with private sector employees. Now retention rate is 92%, which we're very proud of. I think it's the fact that people have tried lots of different things, maybe been a little bit disappointed with the provision in education, maybe been a little bit disappointed with Job Centre Plus, and come to a specialist provider, as we are, where we understand the condition of Down syndrome, we understand how people learn, how they will communicate effectively, and then we're able to address the apprehensions, the concerns perhaps of an employer, and give them the training and all the information that they need. And we bring those two parties together with a lot of ongoing support, and we just find that's a very, very effective model. Yeah.
Very much. Neil Coyle.
Thanks, Chair. hopefully you'll have heard the earlier panel who outlined their concerns about the fear that's been created for many people about the proposed changes to the work capability assessment. I just wonder if you could give us your overview of what impact those changes will have on the number of disabled people engaging in work.
Well, we know that benefits and assessments are a very worrying thing for people that we work with and their families. We know that a lot of the things that they have are very hard won. They've been through lots of battles. In our view, having the PIP assessment and not having a work capability assessment is absolutely the way to go, if that was a possibility, if that was something that could happen, because the PIP assessment is very thorough and it's something the families are comfortable with and they're used to it. So that would be our preferred, just to have a PIP assessment.
Yes, thank you. In terms of, from our side, I think there is, as was mentioned in the previous panel, a bit of a mismatch between assessment descriptors and what in practice is required of somebody to do the jobs that are available in practice. Often, again, this focus on sort of punitive measures for people who are, through no fault of their own, shut out of the workforce. Most autistic people do want to work. It is very worrying for a lot of the people we support, and for a group that struggles particularly with uncertainty. The nature of a lot of policy reforms in general is it's sort of big headlines in the press, details come a lot later. It's often, as was said in the previous panel, people are not necessarily aware that, this isn't legislation yet, and that process actually takes a very long time. So that anxiety being very drawn out is particularly difficult for autistic people. And again, my concerns, it's not an area we work a lot on. My concerns around it are more about the narrative that it feeds and how that ties into wider attitudes around disabled people and autistic people not trying hard enough, and the knock-on effects that has in other areas, including when seeking reasonable adjustments at work.
Yes, I'd say, firstly, in terms of the proposal to ultimately get rid of WCA, that is something we tentatively do support, because the WCA does cause stress and anxiety for lots of people. In terms of the proposal to make it harder to go into the LCWRA category, that is something we are concerned about, because that would of course lead to fewer people getting that extra support, which is about £300 extra a month. And so I think the main impact of that will actually be fewer people receiving that extra support rather than necessarily being pushed into work.
Thank you. And then if I could turn to support in job centres, because you've each made points already about this. And Alison, I wanted to ask about the support you mentioned to one job centre, some training you gave to, I think it was a disability employment advisor?
It was to a team of people there. I contacted them to talk about WorkFit and say what kind, would they be interested in developing an opportunity with our support, and outlined all of the support that we could offer. And they said yes, we would absolutely be open to do that. We developed a 12-week part-time admin role for a woman locally, and she went in and did the job very successfully. Unfortunately, there wasn't then anything longer term that they could offer.
But in that occasion, I do think the 92% statistic is really strong. Did the job centre pay for your service in providing training?
No, everything we provide is free of charge, both to our candidates and to employers. We are funded through the Down Syndrome Association.
You're not commissioned to do it?
We are not. We get no government support, no.
Is there not something missing here? I mean, if it's you also mentioned training for job centre and disability employment advisors. Is there not a requirement on job centres to make sure they are accessible? And Evan, you made the point about assistive technology as well. Are job centres just not particularly good at being accessible for disabled people if you're having to supplement with additional training and support?
No, go ahead, George.
I think a lot of the issues around job centre accessibility are similar to those that we see in public spaces generally, schools, healthcare advisors and so on, in that there are, like, at baseline, there are requirements to be accessible in terms of the Equality Act and so on, but the needs of autistic people are not necessarily what people think of when they think about disability access. So there's sort of a bit of an education piece there, which, again, I know some job centres have been doing, and I'd welcome that being rolled out. But I think there's a bit of a gap between what theoretically is required on a universal level and actually, in practice, whether that really works for kind of the groups represented on the panel here.
Isn't the question a bit beyond this? Because if job centres just reflected every other workplace, on one level that might be understandable, but on another it's unacceptable because of the higher proportion of disabled people that are meant to be being supported in those specific sites.
When I say it's reflective of the wider world, that means it's a problem everywhere. That's not me saying it's okay. But yeah.
I understand. And Evan, on that assistive technology, but you said it's £500 per job centre.
So it's 5 million for all job centres in the country, and that would include things like screen readers, which help people who are blind or visually impaired to access computers. It would include things like simply headphones, a refreshable braille display, which some blind people use to read computers as well. And then there'd also be some money left over to allocate to each job centre to spend on whatever the local needs were.
But if job centres are not accessible for disabled and are not able to support disabled people in what they do on a routine basis, why have none of your organisations sought a challenge under the Equality Act?
I think from our point of view, because we are providing this service and we're getting people into work and we're circumventing the job centre. Plus, because we do.
If people can find you.
Yes. Well, we have quite a strong membership. More than 20,000 people are members of the DSA, and a lot of what we do is word of mouth, and that's families. So maybe a young person has got a job through us and talks to their local Down syndrome support group and says, wow.
I guess the question is there a risk that the Department for Work and Pensions is failing in meeting its legal obligations to ensure its premises and staff are accessible to the people that they're meant to be supporting into work?
Yes, I would say that, some job centres are fine, some work coaches are great, but overall it's simply not good enough. And we've heard some horror stories of people missing appointments because they're blind and they stand waiting for somebody to tell them where to go, or being pointed in the right direction, but then without noticing that they're carrying a cane and they're blind and they can't see those directions. There are really clear examples of that, and the stat I mentioned about 50% of people not feeling trusted by their work coach is a really clear example of where job centres aren't working for disabled people. And yes, it is charities like us and like the Down Syndrome Association that often pick up the pieces when the job centres aren't doing what they should do.
There's a need for the Department of Work and Pensions to get its own house in order and to make sure that the support is in place. The two schemes that have been touched on, access to work, some of the newer programmes, universal support and the IPS scheme, before further cuts for disabled people are brought forward by government.
Definitely, there needs to be more of an emphasis on what the government can do to support disabled people, rather than what is currently the case. Is often there's an emphasis on disabled people themselves, rather than the barriers they face, rather than employers and what the government is threatening to provide.
Thank you.
Yeah, I think there is an appetite with employers to embrace that and recruit more diverse people, but the barriers are still there.
That very much shines with what we've been hearing. A lot of employers do want to do more and do want to do the right thing, but don't know how, or don't want to be the first to put their head above the parapet. The appetite is there, but there needs to be more support.
Thank you.
Alison, is it in WorkFit, is it your normal experience that a person with Down syndrome can be placed in a job?
Yes, absolutely. We believe everybody can work if they want to work, if they're motivated to work, they have the right position, the right job.
At the moment we have a 30%, was it, employment rate or less?
For people who have learning disabilities, the percentage is 4.8 in paid work. I mean, for our figures are much higher. We've had considerable success with WorkFit. We're working towards our 1,000th job opportunity. Right. So, but that's learning disability overall. It's only 4.8%, which is dreadfully low.
Of the people who come to you, what proportion do you get into a job?
Oh, well, the vast majority when we can work with them, because we've got waiting lists of people who are waiting to work with us, and we work across England and Wales, and we're only a small team. You know, the DSA isn't a huge charity by any means. Obviously, we rely on the funding that's allocated to WorkFit, but we have a lot of other major projects in the DSA, health education, all of those things. So we could do a lot more if, you know, we were government funded, for example. We could be, you know, that 92% retention rate is something that we're very proud of.
Yeah,
so,
quite right.
Yeah.
Very interesting. Our time is up. Thank you very much indeed, all three of you, for
Thank
coming
you.
to talk to us. Order, order.
The proceeding has ended. 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 The proceeding has ended.